Hello everyone, I'm Dr. Shyam Sundar. I'm an assistant professor of psychiatry from Saveetha University, Chennai, India. So I'm going to present about the methodology and the results. So let's dive into the research design. So in this study, we are using a quasi-experimental interventional study design, which means we are looking at the impact of a specific intervention. In this case, a 4-week brisk walking and slow jogging program. We'll be assessing our participants before and after the program to see what changes occur. So when it comes to who can participate, we got some specific inclusion criteria. We are looking at students aged 18 to 25 who are studying full time, do not have any structured exercise routine, and are willing to commit to the 4-week program. On the flip side, we also have some exclusion criteria. We can't include anyone with acute or chronic illnesses that might limit their physical activity, those with psychiatric conditions that require medication adjustments. We also can't have participants who are already engaged in competitive sports or intensive training. The sample size that we have calculated for the study is around 510. So this also accounts for 10% dropout rates, possible dropout rates. In each site of the study, the number of participants depended on the number of students who are available for taking for the study at a particular institution. So, the baseline assessment of happiness and well-being scores were collected, along with some important socio-demographic data and few questions regarding the current pattern of physical activity. After that, we delivered this 4-week intervention of brisk walking and slow running. We reassessed the happiness scores and the well-being scores at the end of 2 weeks and at the end of 4 weeks. The exercise protocol was developed by the Department of Sports Medicine, Saveetha Medical College and Hospital. So let me walk you through the exercise routine. It consisted of proper warm up for 5 minutes, which included dynamic stretches, light jogging in place, um, deep breathing exercises, etc. So the idea here is to wake up the muscles, get the blood flowing, and mentally prepare for the session ahead. Then comes the main workout, which is for 20 minutes, which is the core part of the session. First 10 minutes of brisk walking, followed by 10 minutes of slow running. So to build on the aerobic effort without pushing too hard. That is the idea. And this 20 minutes of walking followed by running is uh, followed by cooling down for 10 minutes. So this included static stretches, gentle yoga poses, mindfulness breathing exercises to help the body relax and recover. So we kept track to maintain that everyone stayed on track. We used the Strides app to monitor their activity. In the next slide, I'll talk about this app. Okay. So we developed an Android app for the sake of the study to ensure participant compliance. It was through a collaboration between Saveetha Medical College and Hospital and Saveetha School of Engineering. So the participants were created individual IDs in this app and they were enrolled in the app. They completed this 30 minutes of consolidated workout on a daily basis. And the supervisors who were allotted to the patients, they monitor the participant engagement and reminded them if the task is not completed. So the data regarding the number of steps taken by a participant, what is the pace, all these were collected. And we chose to go with app because it is generally liked by young adults. So, as a part of the study, we started by collecting some basic socio-demographic details like age, gender, marital status, what kind of degree that they were studying, etc. And also about the participants' physical activity patterns. To assess their well-being and happiness, we used two well-established questionnaires, which is Oxford Happiness Questionnaire, which is a self-report tool assigned to measure the subjective happiness scores. It consisted of 29 items. Scores range from 1 to 6. And for well-being, we use the Warwick Edinburgh Mental Well-being Scale. And this is to know how people feel emotionally and how they function psychologically. This scale had 14 items. It measured aspects like positive emotions, life satisfaction, and general sense of optimism, etc. Scores range from 14 to 70. So the study was conducted on voluntary participation. All participants provided informed consent prior to the involvement in the study. Data confidentiality was strictly maintained throughout the research process. Dr. Nisha, who was the study coordinator, was available to assess the queries from both participants and supervisors, ensuring the clarity and support at each stage. So all information was kept anonymous and data was stored securely in password protected space to ensure privacy. We made sure to exclude anyone with medical conditions that could limit the physical activity like angina, orthopedic issues, etc., since these could worsen during the intervention. Before the study began, we collected the participants' blood pressure, pulse rate, capillary blood glucose, so to rule out any important medical comorbidities. So, if anyone had an emergency during the study, they are advised to report to the supervisor right away and consult a doctor. So, now coming to the results of the study, to start with, we included 215 participants from SIMATS, 204 participants from Institute of Mental Health, Chennai, 50 participants were from Gladness Hospital, Madurai, and 41 participants from Madras Medical College, Chennai. So, as I initially said, the distribution was based on the number of students available in that particular institute for recruitment. And for the final analysis, out of the 510 candidates, 461 candidates, which is around 90.4%, had completed the 4-week physical activity regimen, indicating a good retention rate. In similar studies, more than 80% has been considered as a good retention rate. Whereas in our study, we had 90.4% retention rate. And so the dropout was 9.6%. For the final analysis, data from only these 461 candidates were included. The common reasons for student dropout were absenteeism from the college, some academic commitments, and also some personal commitments like family commitments, etc. These were the common reasons quoted by the students for dropout. So, coming to the demographics, the mean age of the population was 19.87 years, out of which 72.7% were less than 20 years of age. So, gender distribution, 67% of the population was female, 33% was male. Uh, Education stream, 48% were from the nursing stream, 12% were from the medical college, and 32% were allied health sciences like physiotherapy, occupational therapy, etc. So 88.5% were in an undergraduate course and 13% were in a diploma course. 98% of the individuals were single during the study period. Coming to the physical activity patterns, so initially, before we started this 4 week of exercise regimen, only 32% of the students actually had any form of physical activity. So, this gives us an important baseline for understanding how exercise habits may have changed over the course of the intervention. And we were shocking to know only 32% of the individuals engaged in any form of physical activity. So the common activities among this 32% was walking, gym workouts, and sports. The number of steps taken by the individuals on an average per day during the study is 3,072 steps. Coming to the main indices, so the happiness score at the baseline, 56% scored above 4, indicating a higher level of happiness. And by the end of 2 weeks, this proportion arose to 70%, reached the threshold. And at the end of 4 weeks, 84% achieved the higher happiness index. So we had a linear increase in the happiness scores in the Oxford Happiness Scale. So this is an even detailed breakup. So upon taking a closer look, there was a gradual shift in the scores from the category not particularly happy or unhappy, which was high at the initial part of the study. Then gradually it shifted from that to somewhat happy, rather happy, and very happy. So coming to the well-being scores through Warwick scale, um, the 51 and above is considered as a better well-being score as per the scale. So in the baseline, 56% of the individuals were below the mean well-being score. At the end of 2 weeks, it arose to 62%. And at the end of 4 weeks, it arose to 65%. So we had a gradual increase in the well-being over the period of the study. And this also was a linear increase, but the percentage of increase is not as steep as the happiness indices. So the findings from this 4-week interventional study demonstrate a positive impact of daily physical activity on happiness and well-being. So using validated instruments, we observed a progressive increase in both the scores, um, from 56% to 84% on Oxford Happiness Questionnaire and 56% to 67% in the Warwick scale. So these trends show that even modest daily physical activity can yield substantial psychological benefits within a short time frame. So how do we interpret these findings? So the observed improvement aligns well with the existing psychological theories and physiological theories. So, physical activity is known to influence mental health through multiple mechanisms, including release of endorphins, a reduction in cortisol levels, improved sleep, enhanced self efficacy. So, among that, brisk walking and slow running are very accessible, low cost, and low barrier activities, especially may appear more suitable for students who face time constraints and stress. So the progression over the 2 weeks and 4 week interval suggests that psychological benefits may be cumulative. As early as 2 weeks, we were able to see some difference in the happiness and well-being scores. So the steep increase in these outcomes supports the hypothesis that continued engagement yields increasing results on the well-being, at least over the short term. So how do we compare this study to the global data? So even globally, similar trends have been documented. A 2018 study published in Lancet Psychiatry analyzed data from over 1.2 million individuals and found that people who exercised had 43% fewer days of poor mental health compared to those who did not. And also, moderate intensity activities, such as what we used in this study, are among the most effective types for promoting mental well being. One more example is a study from UK, Mental Health Foundation and Public Health England. So they emphasized the role of physical activity in improving mental health through the same Warwick scores that we have checked in the study, which is higher among the active individuals. And typical population-based increases in well-being was around 8 to 15%, which is comparable to the 11% increase that we observed in our study. So these global findings underscore the validity and relevance of our results and suggest that the psychological benefits observed are not only predictable but also scalable across different populations. But our study also had some limitations. Um, while promising, these findings should be interpreted within the limitations of the short duration of the study and the self-reported study design. So more long-term studies, including objective measures of physical activity and more diverse sample population, would strengthen the generalizability of these results. And furthermore, exploring the differential impact across gender, baseline mental health status, academic pressures could yield more targeted recommendations. So what are the implications that we make from this study? So given the clear association between physical activity and improved happiness and well-being, these results advocate for the integration of structured, accessible physical activity programs into student routines. So the universities and educational institutions should consider incorporating such brief daily movement programs like brisk walking, jogging, slow running, etc., as wellness initiatives. And additionally, uh, we can also view this from a public health angle, wherein we can see these interventions as improving the youth mental health in general and not just for students. So short-term, non-intensive interventions can be recommended as a first-line non-pharmacological approaches towards preventive mental health and promotive mental health among the young population. So these are my references. Thank you so much for your patient listening.